Well, this is a very bittersweet time for me. This will be my last State of the School, but it is also a time to share our amazing accomplishments. And we have many amazing accomplishments. So I'm eager to get moving forward and telling you what they all are. But first, I want to thank Sarah, who's hiding here behind the screen, helping me change slides, because if it wasn't for Sarah, there wouldn't be this wonderful State of the School address. She is wonderful at writing and finding the best video slides for us. So I thank you very much, Sarah. And you may have noticed when you came in that there are bags of Christmas cookies at the back. These are Christmas cookies made by, we always call her Jerry Kramer's sister-in-law. Jerry, what's your sister-in-law's name? Jean. She's been doing, what? Jeannie. And we've had Jeannie's cookies every time I've had a holiday party at my house. We have these wonderful big trays of her cookies. And so we thought, since we couldn't do that this year, at least please take a bag of cookies home and either keep them in your office and eat them yourselves, or share them with your families, whichever you want to do. Well, welcome to our 2021 University of Buffalo School of Nursing State of the School address. I'm just so glad that you're all here and that we're here primarily in person to be able to share what's happened over the last year or so. In her poem, The Hill We Climb, Youth Poet Laureate Amanda Gordon reflects on the challenges we face as a nation and on the loss and upheaval of the past 2 years. She also poses a poignant question about hope and our road forward. And she says, I quote, "When day comes, we ask ourselves, where can we find light in this never-ending shade?" End quote. The past several months have been unique, troubling, tiring, scary, but energizing and eye-opening. Together, we've experienced a watershed moment, one that has compelled us to closely examine ourselves and our world. A moment that, while challenging, is full of opportunity and hope. And that hope and the good precipitated from those opportunities exists because of each and every one of you. And I thank you all for what you've done, all forever, but for sure in the last several years. You have been nimble, creative, courageous, innovative, and responsive to our students, to each other, and situations as they arise. You have created new ways to deliver education and conduct research. You have nurtured our students, and you have developed important relationships with the community. As we continue to emerge from this now familiar darkness, I would like to shine a light on the many wonderful achievements of our students, faculty, staff, and alumni. Work that did not just keep us afloat, but rather made the state of our school stronger than ever. One measure of our strength is our continued dedication to the communities we serve. Over the past year, we worked to mitigate COVID-related stress in minoritized communities and improve care transitions among homeless populations. We continue to partner with community organizations and schools across the university to better understand and address health disparities in Buffalo. Our faculty, students, and alumni have also played an integral role in vaccination efforts and vaccine education, a crucial step in the country's emergence from the pandemic. We were elated to return to important in-person service and partnerships this year, like the remote area medical and our ECMC collaboration that aims to improve clinical judgment. Our wonderful students also stepped up to help communities at home and abroad, from promoting breast cancer awareness, participating in health fairs, donations for vulnerable patients, and volunteering in food pantries to fundraising for refugees affected by the Beirut port explosion. Our ability to understand and respond to the needs of our community is paramount to making a real impact. We continue to examine our curricula to weave in elements of justice, equity, diversity, and inclusion, and we continue to build a support system of mentors for our students. In doing so, we're helping to produce empathetic, culturally conscious healthcare providers and researchers who understand social determinants of health, who work diligently to address the health disparities affecting so many across the nation and right here in Buffalo. Our ability to generate and apply new knowledge is largely dependent on the growth of our research portfolio. And I am proud to say that we have continued on an impressive upward trajectory. Since May 2020, our incredible faculty and the Center for Nursing Research staff have secured more than $11 million in external grant funding. These studies and initiatives will empower us to improve health outcomes in vulnerable populations, improve care transitions, increase the number of behavioral health professionals in Western New York, and explore the effects of peer victimization on the LGBTQ adolescents. We also continue to see more of our students publishing their research. This past year, students published on topics that include providing affirming care to gender diverse patients, reproduction coercion in rural populations, barriers to engaging in stroke rehabilitation, the role of nursing care, transitions, and cognitive fatigue in MS patients, just to name a few. Our School of Nursing is a small family within the largest research university in the SUNY system, but we continue to be instrumental in the university's strategic goal to achieve a greater societal impact through interdisciplinary research. These outstanding research efforts are crucial to helping UB realize its vision to advance into the nation's top 25 public research universities. Recognition of UB and the School of Nursing doesn't end with research dollars. We see our strengths reflected in the perception of our students as intelligent, well-prepared practitioners who stand out among their peers. There's no doubt this is due to our continued innovation in the classroom. During the disconnectedness of COVID, our faculty found creative ways to help students connect what they learned in class with clinical practice to develop a spirit of inquiry. We also continued to focus our interprofessional learning opportunities, such as Friday Night at the ER, which are increasingly crucial for the preparation of effective person-centered practitioners and researchers across the health sciences. Our experiential learning opportunities also expanded over the past year. Our dedicated education unit offerings grew with the addition of Brylin Behavioral Health, which will provide another avenue for our undergraduate students to work with patients in behavioral health settings. And as we continue to focus on securing more clinical sites for DMP students, we are recharging our relationship with Jericho Road Community Health Center. This relationship will provide students with vital knowledge and experience in providing nuanced care for marginalized and growing refugee populations. Over the next year, we will continue to expand our ability to provide our students with educational experiences that set them apart with our new telehealth suite and the implementation of the concept-based curriculum in fall of 2022. It's not just the community and the employers that see the strength in our students, alumni and programming. Prospective students are taking note of the high quality experiences and education we offer. And many more are choosing UB School of Nursing to begin or to continue their nursing careers. Since 2019, Our total enrollment across all programs has increased more than 29%. This is due in part to the needed expansion of our RNBS program. But during that same time period, our graduate enrollment has increased by 21%. Our national reputation and increasing visibility, no doubt, have also played a significant role in the growth and strength of our school. We have held steady among the top 25% of graduate programs in the nation, and our nurse anesthetist program, which was recently awarded maximum reaccreditation for 10 years, is the top CRNA program in the state. Our RNBS program has always been top-notch, and it is ranked number 8 among all online baccalaureate programs in the country. UB School of Nursing graduates also continue post-stellar licensure and certification exam pass rates that exceed both state and national averages. Amid the stresses of the pandemic, this is especially impressive. It is certainly a testament to our dedication to our students and of our students' dedication to the noble profession of nursing. Our students and faculty have earned so many national and international accolades that have put our school in the spotlight. Several of our students are Schomburg, Presidential, and Stephanie Mucha Fellows and Scholars. We also have an impressive 6 Senator Patricia McGee Scholars. This program aims to increase the number of nursing faculty in the vital role of preparing New York State's future nurses. As we know, this is a great pressing need in our profession. Recently, the school also saw its first student join the National Medical Fellowship's Primary Care Leadership Program. This selective program provides future healthcare professionals with an opportunity to experience the challenges and rewards of primary care practice in community health centers. We've seen year after year just how accomplished and impressive our faculty are. This past year has reinforced that point. Faculty have received such accolades as the UB Exceptional Scholars Award, the American Journal of Nursing Book of the Year, and the Ruth T. McGrory Leadership Award. Perhaps most notable was the induction of 3 of our faculty as fellows in national and international organizations, including the American Academy of Nursing, Sigma Theta Tau International Researcher Hall of Fame, and the American Association of Nurse Anesthesiology. This year, with the emphasis on the university of truly trying to move our faculty to gain more and more awards, I have put together an ad hoc committee of fellows from the school as well as our division chairs to start looking at what are some other awards that we might want to be looking for, and how can we nurture, support, mentor, and move our more and more of our faculty to receiving these awards. UB has found that we do a lot of good things with awards, but they're usually internal. They're UB awards, they're maybe even SUNY, but what really makes a difference in a university is what can we do nationally and internationally. So that's a goal that we have, and we're moving forward with a small group of faculty looking into that very carefully. Our wonderful alumni continue to enhance and strengthen our reputation as well. This year, we featured our alumni doing an array of incredible work, including sleep health in aging populations, the importance of representation in dermatology, improving diversity in nursing, and shattering glass ceilings through leadership roles. The achievements of the UB School of Nursing community have elevated our visibility, not just across the university and Western New York region, but on a national scale. Over the past year, news from the school has reached more than 2 million people through external media placements. We've also earned nearly 700,000 impressions across our social media platforms and brought more than 100,000 new users to our website. As we continue on this upward trend, I am confident that you will all keep the good news coming so that we can share it with the world. I am pleased to report that despite the uncertainty of the last 2 years, the financial state of our school is strong, largely due to the increased enrollment and our research funding. On the philanthropic side, giving to our school has climbed over the past year. We continue to make strides toward the Boldly Buffalo campaign goal. We did meet and exceeded our $7 million goal, and so of course they raised it. So now we are very close to reaching our $9 million goal. Of note this year, our new JEDI fund qualified for a $25,000 inclusive excellence match, allowing us to endow the fund and continue important work in the areas of justice, equity, diversity, and inclusion. We're also pleased that we have been able to establish 3 new funds this year, thanks to generous donors. We're so grateful for their support of our school and our students. As our strength grows in the realms of research, academics, enrollment, reputation, and financials, we also continue to grow our School of Nursing family. We've welcomed 3 new full-time faculty, 8 staff members, and 5 new babies in the last 18 months. I'm overjoyed to see our team and talents expand, and I look forward to seeing this wonderful school continue to grow and evolve. Last but not least, I'd like to recognize everyone who helped to keep our school community safe and operating at its best throughout the pandemic. Because of the diligence and care of our faculty, staff, and students, our school has experienced a very small number of COVID infections. And when those occurred, our faculty and staff worked diligently to ensure students stayed on track. We successfully graduated 2 classes during the pandemic, something I'm sure none of us imagined. I'm so very grateful to all of you for our smooth transition back to in-person learning, from our facilities to technology to clinical placements. We pulled together to ensure we continue to provide the highest quality education to our students. It's because of all of you that we are able to be together here today. When I reflect on what we have accomplished together over the past 2 years, I'm in awe. Our school did not just find light in the never-ending shade, we created light. I couldn't be prouder or more grateful to be surrounded by so many incredible, resilient, kind, and talented people. Thank you for your strength and perseverance, and for your compassion and dedication to the nursing profession, to our students, and each other. Thank you. Just wondering if anybody had any questions or comments. All of you sitting in the back of the church there. Thank you very much. For those who are, I think we may have some people on Zoom. Suzanne said it was a very moving presentation, and I agree, and I can't take credit for it. I have to tell you that Sarah and Sarah's words put that together. And Sarah hates it when I do that. Grace.
What's on the agenda for?
The question was, what's on the agenda for my future? Well, I was just thinking, you got to go into retirement with, some ideas, and I don't have a lot because I don't want to be busier than I was. I remember my father-in-law retired, and he said, I don't know how I had time to work. I'm doing so much, but actually, the one thing that I'm planning to do in the first year is to self-publish my father-in-law's autobiography. When Andy was born, Roy's dad was an amazing man who had a wonderful, interesting life, was a jazz pianist during the Depression, and also was an English major. So he he told wonderful stories, and I felt badly that my son, Andy, wouldn't hear them. So I said, Dad, would you be willing to just, put that down on paper? Well, when he retired in 76, I think, he retired early because he was a junior high school music teacher, and he was an amazing musician, but he expected his students to pay attention. And in the 70s, they were not paying attention. And he said, enough of this. I don't need to do this anymore. So he bought himself a Commodore 64, and he typed out his about 10 chapters of his autobiography. And as things go, that was what, almost 40 years ago now, and nothing has really been done with it. And my husband thought he might try to do something, but he is not the best at follow through, and that didn't happen. And then he started reading the chapters and trying to edit them. And I said, no, that's in your father's words. You don't change his words. So I thought, maybe when I'm done with doing other things, I can try to figure out how to self-publish a book. So that hopefully will be the Lewis family autobiography, and it will be called Come Good Home. Because every time we left their house to go back home, that's what he would say. Instead of be safe travels, it was always come good home. So thanks for asking. That's my first step. We'll see how long it takes. Hope it doesn't take another 40 years. Any other thoughts? Well, then I am very excited to be introducing you to the university's newest dean and VP for Health Sciences. Dr. Allison Bashir is, as I said, she's the Dean of the School of Medicine and the VP for Health Sciences. And I'm wondering if you'd like to just come down and welcome or introduce yourself to our folks. And thank you for coming. It's just wonderful to have you.
Thank you so much for the invitation. It was a moving presentation. I'm a neurologist by training, and the partnership with nursing and medicine is, there's nothing more important to the care of patients, the education of our community. And I'm so pleased to be here at Buffalo. Already, this is day 5. I got a bit lost. I have to say I got rescued. But I'm really looking forward to working with your school and the other schools of health sciences to really partner and build programs that really keep our patients healthy and teach our students how to keep patients healthy. One of the things that really impressed me so much was the commitment of everyone in Buffalo to the community and to that mission of keeping everyone healthy. So thank you for the warm welcome. Thank you for the wonderful presentation. I loved it. It really, COVID has been terrible, but it has brought out that sense of community that is so important. And I just think that that's something as we just all have to hold on to as we move forward. Together we're all going to achieve just great things. So thank you so much. And I want to hear about the book.
Thank you. And you didn't hear me say, Allison, that there are homemade cookies back up there. So take a bag with you. They're not homemade by me, of course, but they're homemade. Well, the nice part is that I'm going to be here for about 6 more months, so I'm not going anywhere. It gets kind of weird when you talk about leaving, but and I plan to do everything I can to move the school forward in the next 6 months. So this is not a lame duck kind of situation. This is truly, let's see what we can do in 6 months. I'm surely hoping that our 99% will move to 100 or even 110% of the goal by the time I leave. That would be a nice feeling to be able to turn that over to a new dean and say, you've got a good foundation here. And I think we have a very good foundation for a new dean. So that's one of the reasons I decided to retire, that it was, the school's in a very good place. And hopefully you picked that up today. And so we want to just keep moving that forward however we can. So grab a bag of cookies, enjoy your day, and happy holidays to all of you and your families. Thank you.